This video shows you how to do pre-procedure CT planning using the Redo TAV app for cases where the index tab is MyVal and second tab is MyVal or SAPIEN 3. When you click Redo TAV CT planning on the home screen, first you will get the overview of all steps you need to do. The CT acquisition protocol can be the same with routine pre-TAV assessment. It's recommended to obtain ECG-gated multi-basic functional CT that covers the entire cardiac cycle with ideally 20 phases, a minimum of 10 phases. The mid-diastolic phase generally has fewer artifacts, allowing for better assessment of the process reflex and commissure alignment in most patients. The end systolic or end diastolic phases could be used as alternatives. The first step is index TAV and measurement. If a pre-index TAV CT data is available, select native valve morphology and the severity of calcification, and identify your patient index TAV type and size. And then you will get the fundamental information of the valve. The leaflet of MyVal will extend to the top of the commissure tab when it's pinned out by a second tab. So this level is a reference level for MyVal. On the next page, select the index tab failure mechanism and assess commissure alignment. Open your patient CT dataset on a CT software. We can use any CT software. We just need 3D MPL, multi-planar reconstruction module. So after determining the appropriate cardiac phase, align the MPR to be orthogonal to the valve. Rotate the MPR, make sure it is orthogonal to the valve. And assess commissure alignment, which refers to the relations between the native aortic valve commissure and THV commissure tab. The commissure offset is directly measured using an angle tool with the limits aligned with the THV commissure and the native commissure of the RCC and LCC. The angle in this case is 46 degrees, so select severely misaligned, and perform the measurement of area and perimeter. These measurements will be used for second tab sizing later. We can also understand how much the index tab is underexpanded at this point. For MyVal, 3 levels require assessment: outflow, narrowest level, and inflow. Here is the outflow level, down the window level, and measure the area by tracing the center of the stent frame because of the less blooming artifact. Adjust the tracing if needed. And now next move to the identify the narrowest level and measure the area by tracing the center of the stent frame. And adjust the tracing, you get the area. And lastly, move to the inflow level. After or during the measurement, please fill in the areas and perimeters in the app. Step 2 is identify your patient coronary risk claim, which is defined as the lowest level of coronaries in relation to the MyVal reference level. on the CT, now scroll up the plane, then you can see the bottom of LCA. So this level is below the top of the commissure tab. Next is RCA. So identify the bottom of RCA. Now you can see the bottom of the RCA and assess the relative relation to the MyVal reference level. This level is just at the top of the commissure tab. So in the app, we select the bottom of RCA and LCA, and then the app automatically identifies the coronary risk plane. At the step 3, once you select the second tab, you will get an idea about ideal or acceptable level of neoscat plane, NSP, which is defined as the top of the neoscat. For MyVal, in MyVal, it is a single level at the top of the commissure tab. So for this combination, we have only single selection, and this level is above the coronary risk plane, the lowest level of coronaries of this case. Therefore, the coronaries at risk and needed further assessment. Since the second tab size may affect the coronary risk, we need to determine a second tab size first. Step 5 is in vivo CT sizing. We already measure the areas and the perimeter at the 3 level at step 1. On the app, the 3 levels will be automatically selected. So please make sure the numbers are correct. And if you'd like to, check the button of Include Perimeter and click the Calculate button. Then you will get calculated average area, perimeter area derived diameter, perimeter derived diameter. The app cannot suggest sizing at this point due to the FDA regulation, so you will need to choose a second tab size based on your CT measurement. Here has some guide how to choose the size, and here you can get the IFU table too. For this case, I would choose 23 MyVal and move to the coronary risk with the size you chose. Since the balloon expandable second tab could expand an index tab, reducing the VTA distance, drawing a virtual circle of second tab size chosen would be recommended to estimate VTA distance. And identify the narrowest VTA distance from virtual circle or index tab stent frame, whichever is outer, in the zone from the neoscat plane to the coronaries. When the neoscat plane is above the SU junction, please don't forget to assess VT-SUJ. In the app, the relationship between the neoscat plane and each coronary is automatically identified. When the neoscat plane is above RCA or LCA, the next step is the relation between the neoscat plane and ST junction. So in this case, the neoscat plane is below the RCA, so no need to assess VTA. The app automatically identifies and no need to fill in. So let's assess the LCA side. So now the plane is at the neoscat plane level. So first assess the relationship with this level and ST junction. As you can see here, this level is below the AC junction and just at the VTC. And then draw the virtual circle of the size you chose for second tab. And here VT erotic sinus, and a little bit lower level here VTC. So draw the virtual circle. And now the index tab is outer than the virtual circle. So measure the VTC from the index tab. And then fill in the up. For this case, the risk to RCA is considered as low, but for LCA is intermediate. And you will get the summary report of 3 pages, including the animation representing the relationship with the nail scut plane and both coronaries. You can take a screenshot and import to the CT summary report, such as the 3 issue. If available, the information of pre-index TAV CT can be gathered at step 8. This information can help your planning more. These are all steps we need to do for pre-procedure planning. I hope this video helped you planning the Redo TAV therapy. Thank you.